Welcome to this week's episode of Ask Dr. Jessica. Today we're bringing back Dr. Amy Gelfand. She's a pediatric neurologist and headache specialist. We're going to talk about headaches and children. Before I get into interviewing her about headaches, I also wanted to brag about her for a little bit. Because I'm so proud of you. Amy went to, so not only is she a scholar, she went to Dartmouth undergrad, Harvard Medical School, San Francisco for her pediatric residency training. Correct me if I'm saying anything wrong. San Francisco for her neurology training, and then she did a headache fellowship, which there are very few true pediatric headache specialists in the country. But she's also a phenomenal mother of three. Her kids are phenomenal. And she has a lot of chickens and she's an animal lover. She grows things, she grows plants. Can you just for a second tell me a little bit about how your animals are doing? Just so.
You are amazing. This is great.
You are. And you compost.
Yes. We have some wonderful chickens. We also have.
Are you allowed to say how many? Or
we've got about 12. And we have two little mini Nigerian dwarf goats.
Wow.
Who are about the size of a mid-sized dog and just as friendly, and they're adorable. And so we're having a really good time with our little backyard farm.
How do you do it all? You're amazing.
They're my therapy. Those are my therapy goats. They keep me calm.
I love that. What a healthy therapy outlet.
Yeah, exactly.
All right. So since I have you and you're a headache specialist, I wanted to ask you some general questions about headaches in children. So first of all, how common are headaches in kids? Like, so if a parent tells me that the child has a headache, is that a common situation? Should parents worry about this?
Well, unfortunately, headaches are very common in kids and teens. There are a number of different reasons that kids might be having headaches. Some of the most common would be tension type headache, migraine, or headaches after a head injury. For example, if they have a sports concussion and then they're developing headaches after that. If they're coming in,
now tell me also, sorry, what is a tension headache? Will you talk about that for a second?
Yeah, so that tends to be sort of band-like pressure quality pain that tends to be bilateral. It's not usually too severe, and it doesn't have what we call associated features like light sensitivity and sound sensitivity and nausea to any appreciable degree.
So right here, I tell parents.
Yeah,
exactly. A band like here, yeah.
Yes, okay. Yep, you got it. And certainly tension type headaches happen in kids, but interestingly, I don't think that they cause a lot of disability, because most often if somebody's coming in to talk to the pediatrician or to talk to a neurologist about headaches that they're having, it's usually going to be migraine or some other headache disorder like post-traumatic headaches. But for kids with migraine, migraine is actually remarkably common in kids. By fourth grade, so if you take about 10-year-olds, by fourth grade, there's on average a kid with migraine in every classroom, because the prevalence is approximately 5%. And if you compare that to other neurologic illnesses like epilepsy, it's much more common to have migraine than to have any of these other neurologic illnesses. So it's a big problem for kids and teens.
Wow, so 5%, so 1 in 20 kids suffers from migraine headaches.
By age 10, and then as they go through teenage years, the prevalence actually increases from there. So it's a really common problem.
Now, what are the signs a parent can look for in their child to know if it's a migraine headache?
So migraine is best thought of as a dysregulated or amplified sensory processing disorder, and it's fundamentally genetic, but it's so much more than a headache. It's amplified perception of light seem brighter than they really are, or sound seem louder than they really are. There can be an illusory perception of movement, which we call vertigo, where it feels like the body is moving or swaying or things are spinning and they're not. It can also just be sensitivity to movement in general, where, just walking makes the head pound. The quality of the pain tends to be that pounding or throbbing type of pain. And you can observe, especially for younger kids who might have difficulty saying that lights are bothering them or sounds are bothering them, you can also observe their behavior. What are they doing when they have a headache? Are they going to do they want to go lay down on the couch or lay down in their bed and have things generally be quiet and darker? No one's going to miss vomiting. That's a very obvious symptom, but are they complaining that their stomach's upset? Those types of things would be suggestive of migraine in a child.
And they're very genetic, correct? And tend to be
Exactly.
more
Yes.
towards
If we
females?
get the chance to take a really good family history, there's almost always somebody else who has migraine in the family. The
Wow.
caveat I would say is that it doesn't have to look the same way necessarily. So the child might be getting migraine attacks 3 days a week, but the parent with the migraine history has them once a year, and they think, oh, it's not the same thing, but it is the same disease. It's just expressing itself more frequently in the child at the phase of life that they're in right now, compared to what it's looking like in the adult at the phase of life they're at right now.
Okay. And tell me, you've told me this before, so I'm cheating. I know the answer, but does it have a gender preference in
Right.
terms of
So
genetics and who gets migraines?
So before puberty, boys and girls are equally likely to be affected, but as they start going through puberty, then we start to see girls being more commonly affected. And as they get into later adolescence, it starts to look like adults, where women are about 3 times as likely to have migraine compared to men. So sometimes if I'm taking a family history and I'm having a little bit of trouble figuring out where it is, I'll sort of look for on dad's side, what's the paternal grandmother's history, because maybe dad has those genes, but his brain and his body haven't expressed them very much because there's not that overlay of some of the female sex hormones, and so he may not experience headaches very frequently. But if we dig back a little bit into more history on his side of the family, that can often be helpful.
That's so interesting. Okay, so it tends more towards the female side, and even if the father doesn't have it, maybe find out if the father's mother has it, and you'll get a
Yes, exactly. Because I think these genes can come from either side, but they tend to express themselves more in women, which is just unlucky there. And so if we
we're
ask a
better in
bit more
other
about
ways,
that.
right?
Yeah,
We went out of,
exactly. Yeah.
okay. And then is there a chance a kid will outgrow migraines? So let's say, a parent knows their 10-year-old has migraines. What are the odds that they'll outgrow it, or is this something they're going to have to deal with for most of their life?
So because it's fundamentally genetic, you have the same genes, but how often those genes express themselves can change quite a bit over the lifespan. So if migraine is a frequent issue in childhood or adolescence, it does not mean that it's going to be like that for their whole lives. What I often see is that as they get through later part of adolescence and they're not having so much change all the time, they're starting to get a more regular schedule, they're not going through so much growth and development, then things can start to level off, and they might be a person who has a migraine attack once every 2 years or once a decade or whatever. There's a broad range there.
Right.
But it doesn't, having frequent headaches in childhood doesn't mean that it's going to be like that in adulthood.
Okay, that's good. That's good to know.
Yeah, sometimes
Um,
people are really worried about that.
I'll also tell parents to think about the triggers, to really think about what could be precipitating the headaches to come, as a way to manage them for a lifetime. Um, what do you think about that? How do you
This is
advise
like a
parents?
whole
Yeah.
talk topic on its own, but it's a
Yes.
really interesting area, and I think it's really complicated for a couple of reasons. One is there's also a phase of migraine attacks called the premonitory phase,
Okay.
which is before there's headache, but some of the changes are already happening in the brain, in this area called the hypothalamus, that is involved in migraine and is involved in mood and appetite and sleep and wake. And so people can have symptoms such as fatigue, light sensitivity, nausea, food cravings, and those symptoms then are followed by the headache phase. And sometimes it's hard to know, was there a trigger? Did bright lights trigger the migraine attack, or was somebody already in the premonitory phase, perceived normal lights as being bright, and then the headache just followed? The other example that sometimes comes up, I'm a big chocolate lover, so I'm very interested in this question of chocolate triggering migraine. And there's a study where people were given chocolate or the control substance, and they were equally likely to have a headache follow, people with
Oh,
migraine.
that's good to
And
know.
so it doesn't seem like chocolate is triggering migraine. And what I think might be going on is that if the brain has entered this premonitory phase and there's a food craving, somebody might go eat chocolate and then notice that the headache follows afterwards. But it's not that the chocolate caused the migraine attack, it's that the migraine attack was already starting, in some ways maybe caused the chocolate eating, and then the headache phase followed. So it's a really complex area. But taking a step back, the brain of people with migraine really likes things to be as regular and consistent as possible. So regular sleep schedules, regular exercise schedules, all those sort of things. And one of the issues that makes it sometimes challenging as a kid or a teen is your schedule is always changing, school schedule is always changing, homework, all of that.
Yes.
And hormonal cycles for adolescent girls. One of the things that can be activating or triggering for migraine is menstrual cycles, and those are often irregular when they first start. And so there's a lot that's going on for this age group where it's hard to keep things regular from that standpoint.
Okay. So teenage girls, as they get older and things become more regular, do you find that the symptoms get better with headaches?
I
And
think that's part of why time is generally speaking on their side. As the body gets more mature and has more regular cycles and just more consistency, I think that's part of why things do tend to settle down.
I also like what you said about chocolate because when I learned about migraines, I heard one of the teachings was to avoid migraines, you have to tell adults to avoid their favorite things: chocolate, alcohol, and cheese. And
So sad.
so I said, okay, so that's not necessarily true. Or
No,
maybe,
I mean
or
it's
caffeine too.
interesting.
Yeah.
Yeah, there have been these studies where people have kept track of everything they eat and their habits and so on for 90 days. And it's really a complicated thing to figure out what's a trigger
Right.
for even individuals. Sometimes things that we think are triggers aren't, and something we might not have even noticed might be correlated. And it can be a really complex area.
So what about preventing headaches? Like, so if a child tends towards getting headaches, what can parents do to prevent them happening? I know we talked about getting more sleep, having a more regular schedule. Anything else like supplements or
Right.
other?
Right. So one thing, regular sleep we were talking about, and if their school district isn't following American Academy of Pediatrics guidelines and starting, the AAP says that middle schools and high schools should start no earlier than 8:30 a.m. because we know that adolescents can't fall asleep as early as younger children, and so they still need at least 8 hours of sleep. So
That's
to help
interesting.
them, we need to start our schools a little bit later. So if their schools aren't starting at that time, they could advocate with their school board to try to change that. But there are things that we can give to help decrease migraine frequency, and some of them are supplements. So, riboflavin, which is vitamin B2, can help with decreasing migraine frequency. Magnesium may be helpful, coenzyme Q10 may be helpful, and melatonin at night can also help with decreasing migraine frequency.
All right, so trying supplements, regular sleep. And then at what point do you recommend taking a stronger medication, like seeing a doctor like yourself, where they need a prescription medication for migraines?
Right. So I think it's always a good idea to consult with the child's primary care provider and make sure, first of all, that they think the diagnosis is migraine, that there's nothing concerning for something else going on. Some of the signs that would be concerning for another kind of cause of headache that might need to be acted upon would be double vision, or with headache attacks getting weak on one side or numb on one side. Those things might be indicative of migraine aura, but we want to make sure that there's nothing else happening. So
Okay.
first, getting to a clear diagnosis, making sure that we're dealing with migraine.
Okay.
And then I think in terms of decreasing frequency, trying those types of lifestyle interventions like regular sleep to the extent that the family can. I don't think people should send themselves crazy, because sometimes it's just there's different members of the family and lots of people have needs, and I don't think people need to really just completely change their lives. But thinking about that, thinking about some of the supplements, and it does take about 6 to 8 weeks of using a migraine preventive to know if it's going to help decrease migraine frequency in a child or a teen.
Okay.
If that's not helpful, and you've given a good round of one preventive strategy, I think it's reasonable at that point to refer somebody to see a neurologist and see what else we can do to help with decreasing migraine frequency. Because there's certainly a lot of treatment options out there, and I think that migraine is it's a very treatable neurologic cause of missed school, impaired performance at school, missed activities. And so to leave that untreated seems like such a shame if there's something we can do, which in the vast majority of cases, there's definitely something we can do to help. So I think it's worth bringing somebody in if they're having that kind of a problem.
And I know migraines account for a huge number of missed days of school and missed days of work. So that's good. Okay, so what about like the typical tension headaches that I see, not like kind of delving away from migraines, kids that come in that come home from school and they have headaches, or they wake up in the morning with headaches. Is it okay for parents to give these kids Tylenol, ibuprofen? Do you have a preference? Anything on?
Yeah, those are both really
on those medications?
reasonable. Yep, those are both very reasonable treatments. I think of ibuprofen as maybe having a little bit stronger evidence for being helpful for headaches in kids, and it lasts a little bit longer in the body.
Okay.
6 hours instead of 4 hours with Tylenol. But on an individual basis, some people find Tylenol more helpful. Some people find Advil, ibuprofen, acetaminophen. So either one, I think, is a really reasonable thing to try.
So sort of the parent can pick either one and see what works best for the child. Okay.
Absolutely.
Now, what about how many days in a row should a parent do that for? So let's say their child has a headache and they've been giving them Tylenol for 7 days in a row. What would you say about that? Because I've heard you can build a tolerance to these medications after a few days.
So I think that the concern that comes up there is this thing that's called, it's not a perfect name, it's called medication overuse headache, which I think is an unfortunate name because it sounds like it's sort of landing some blame on the patient, where all they're experiencing is a lot of headache and they're trying to get better. But it's this phenomenon where if you're taking certain acute treatments for headache frequently over a period of time, it can start to paradoxically drive up the headache frequency. This does not happen to everybody, but it's hard. We don't have a great marker for who's going to be sensitive to it and who's not. So generally speaking, we usually tend to counsel trying not to exceed certain limits. But the limits are usually around how many days per month somebody's using these medications and over time. So I don't worry too much about as long as they're not exceeding any safety dosing frequency sort of things. But from a medication overuse headache standpoint, I don't worry too much if they're doing it, daily for say 7 days. Usually with that class of medicine, somebody might say, try to limit them to less than 15 days per month on average. Okay. If you have a rocky week here and you need to use it more, I think that's an okay thing, as long as on average you're staying under 15 days per month.
Okay. Oh, that's good to know, because that's really good to know. So like a female that is having bad headaches with their menstrual cycle, it's okay if they take ibuprofen throughout their menstrual cycle. That's okay.
Definitely. And that's a really good example. There are even some studies for menstrual related migraine where women and adolescent girls would take a triptan, a migraine specific acute medicine, twice a day for 5 days around their menstrual cycle to help with those headaches. And that's an effective strategy too. And certainly you could use them with NSAIDs like ibuprofen or naproxen. And I think that that's a good idea in those situations.
And is there anything else, this may sound like an obvious question, but anything else a parent should think about when their kid has a headache, like have them drink water, have them rest? Any other general advice to help with headaches?
I think the kids will often find those things for themselves. Like they'll go and lay themselves down. But it's certainly a very safe thing to encourage them to drink some water. And often if they're taking pills or something like that, they're going to be taking water anyway. I would say an important thing if a child says they're having headache is believing them, because headaches, they're invisible. We can't see it. And I think it's important to believe children, because sometimes adults in their lives won't necessarily believe them. And I think that's a really sad thing for these kids. But, believing them, and then you can observe what what kind of behavior they're having, if they're going to lay down, turn the lights off, those sort of things. And then if it seems to be a recurrent problem that's affecting their ability to go to school or enjoy their activities, or just causing them impairment in their quality of life, then advocating for them and getting them into medical attention to get a diagnosis, to get good treatment. I think all of those things are important for parents.
I think that's an excellent point. I say that all the time, that a headache here and there is okay, but at the point where it gets in the way of their day-to-day enjoyment, activities, going to school, that's when I think about, intervening a little more, sending them to a pediatric neurologist like yourself. So,
Yeah.
and what about warning signs? Are there any headaches that a parent should immediately see a doctor about? Is there a time of day that we worry about, or a frequency that we worry about? Like, what are signs that parents should think about when to go to the doctor?
Yeah, so exactly. Everybody's worst nightmare, of course, is this coming from a brain tumor? So I think the things that would worry me, waking up in the middle of
I thank Google for that a lot. A lot of
yeah,
parents will say
right. Waking
Dr.
up in the
Google.
middle of the night with headache. So when we're lying flat, if something is growing and causing pressure in the brain, when we're lying flat is when pressure may be increased. So headaches that are waking children up out of sleep, particularly if they're waking up and vomiting, that would be more concerning. And if they are having any changes with their headaches in their ability to talk or understand, their mentation, their one side of their body isn't moving properly, or they're not feeling properly on one side of their body, they're complaining of double vision, seeing two of things overlapping, or their eyes look like they aren't aligned correctly, that's the kind of thing where we want to see that child right away. Most of the time, fortunately, there's nothing like that going on. And the most common cause is going to be something like tension type headache, migraine, those types of headache disorders. But any
You're
of
saying
those,
brain tumors for children are very rare.
very rare.
Yes, yes.
So I think the main things that are to remember are waking up out of sleep with headache and vomiting, weakness or numbness on one side of the body, double vision, eyes not looking aligned.
Okay, so if a child wakes up at 2 a.m., complains of headache, and starts to vomit, that's a reason to go to the emergency room.
Yep.
You would say,
Yep,
okay.
exactly.
Okay. All right. Oh, one last thought I have. What about screen time? Do you have any advice for parents where their kids get headaches from screens, like taking screen breaks? Do you have general advice in that area?
Right. So I think there's two issues. One is screen times around bedtime, which is a complex problem because the blue light coming off of the devices can block our brain's melatonin production and make it harder to fall asleep. And that's particularly an issue that adolescents are sensitive to. Yes. And this is so hard. I imagine this comes up in your practice because a lot of them are doing their homework on their devices because that's where they're supposed to, and they have to do their homework until bedtime. It's really hard. But I think that if it's at all possible to avoid devices in the hour before bedtime, I think that is very helpful for helping with sleep.
So I'm going to say that again. So 1 hour before bedtime, take a break.
No devices.
Okay.
But I know that's asking a lot because they might have to do their homework still. Okay. But ideally, 1 hour before bedtime, no devices, or at least put that blue light filter on so that they're not getting the blue wavelength light. More generally, devices during the day and so on. I approach it the same way that I approach really any other activity. People, the brains like to have things be very regular. And just like I would say that too much soccer, if you play soccer for 6 hours straight, that's going to put a strain on your body and your brain. And I wouldn't recommend doing that. I would say take some breaks, drink some water. Same thing with screens. You don't want to be doing that for hours and hours straight. Take some breaks, do something else. Right. And so I think of it as sort of the same in that way, that too much of anything is probably not ideal, and that we need to take some breaks and break things up a bit.
Thankfully, our kids are back in school, right? Thank you. Anything else that we should talk about headaches that I haven't covered? Any last thoughts?
There's so much out there.
Are you really busy? Do you feel like, is it a very common, I think it would be, but is it a very common issue that parents reach out to you for?
Yes. I think that if there's anybody who's following who wants to go into neurology and wants to be a pediatric headache specialist, we need you because there are so many kids and so many teens and families who are really struggling with these headache disorders and their impact on their lives. And I think it's an area where we need more research, we need more attention. There's a lot of stigma around headaches, where people are either not believed or assumed to be making it up or somehow not being strong in some way. And I think that's a really big problem that we need to work around as a society, and thinking about as a society, what's our responsibility for helping to decrease migraines and other headache disorders in kids? Because some things are beyond the control of the kid or the
Right.
family. School start times are a factor for this. And so I think as a society, we could do a lot better for these
I think it's
kids.
such a good point you make that you can't see the headache. Like you can't visibly see it like you could see a rash or something physically on the body. And so I do have parents that say they're not sure if they believe their kid, they doubt their child. And it's interesting because you're right. Why not give the child the benefit of the doubt and believe them, because headaches are so debilitating.
Yeah, there's no lab test where we can say, okay, your migraine is at a
Right.
8 on this lab result, or it's not like a broken arm where the cast is
Right.
obvious and we can see the break on the X-ray. It's something where it really is based. The diagnosis is a clinical diagnosis based on the reporting of the symptoms from the person who's experiencing them, and so they really are the owner of that information, and I think it's important that we believe them.
Absolutely. Amy, this has been so much fun. I adore you. I thank you so much for
Oh.
being here. I hope I get to see you soon
I
in
hope I get to
person.
see you soon too. And it is so fun to be with you. And thank you for doing this. Thank you for your interest in headache disorders in kids. And I hope to get to do it again sometime soon.
And if people want to see you, can they schedule televisits with you or make
Yes,
an appointment?
yes.
Really? Okay. All
I'm
right.
at UCSF in San Francisco, and we are doing telemedicine new patient visits.
Amazing. All right. All right. Thank you so much.
My pleasure. Bye.